Right now at 6, eliminating health care for law enforcement and firefighters. It's a real concern after a recent ruling by the state.
The I-Team's Sean Gallagher explains how a decision over a decade ago has opened a dangerous door that could get rid of health insurance for some public safety employees.
It's been 11 years since Act 10 was passed here at the Capitol building in Madison, effectively ending collective bargaining for state employees, with the exception of police officers and firefighters. But a new interpretation of that law could end health insurance coverage for the Racine police and firefighters. And there are fears it could extend statewide, impacting thousands more.
Those law changes back in 2011 provided public employers in Wisconsin with almost unilateral authority to make most changes with regard to a law enforcement officers or firefighters' health insurance plan and their benefits.
Jim Palmer is the executive director of the Wisconsin Professional Police Association, the statewide police union. He says the WERC, the Wisconsin Employment Relations Commission, recently ruled in favor of the city of Racine, allowing the city to provide retiree benefits starting at age 55 instead of age 50.
So now you have an officer who's getting ready to retire that is looking at the prospect of having to put in 5 more years.
But what concerns Palmer even more is this part of the WERC ruling. It states the statute gives the city discretion to determine whether it will even have a health insurance plan for public safety employees. Is it too far-fetched for me to say that Racine police officers are at risk of not having health insurance provided by the city?
Well, by virtue of a recent decision from the Wisconsin Employment Relations Commission, I think that is the case. We think that is a total misreading of the law.
I want to be really clear about that. Nobody's losing health care benefits. We've taken the plan and moved it to a high deductible plan.
Racine Mayor Corey Mason was vehemently against Act 10 during his time in the state assembly. That law is what the WERC cites in its decision.
I take no solace in sort of saying I told you so, but this is what we said would happen if Act 10 passed.
Mason says the move to a higher deductible plan helped close a $4 to $5 million budget gap in the past. So despite the WERC decision, they will still have health insurance under his watch.
We're always going to have health care for our employees. The market will require us to do that. I think the question is, what's the share that employees have to pay and what's the share that taxpayers will pay?
According to the Racine budget, in 2021, the city spent more than $1.1 million less on police health care than it did in 2018.
If you're looking at a scenario where every year you're looking at a 2, 3, 4, 5% budget shortfall, you have to look at either reducing benefits or reducing services.
Is there anything preventing the next mayor, the mayor after that, from eliminating health care?
I think that would be a foolish move for anybody to say. I mean, at the end of the day, you still have to recruit and retain people to be able to do that work.
Mason says at a local level, the city has tried to increase funding through property tax increases. 65% of Racine voters said no to that in 2020. And 56% again voted it down during the primary election earlier this month. So for a longer-term solution, Mason's eye is turning to Madison.
What I would prefer is to have partners in the state legislature who are sitting on an historically large surplus right now actually give money to cities so that we can fund police and fire and give them the resources they need and the raises they deserve.
That surplus is some $3.8 billion. Without help from that or changes to the bargaining laws, Mason says it leaves the city no choice.
When you put those two together, you get the impasse that we're at now.
I think it's opportunistic and dangerous in the short term.
Palmer and Mason have shared concerns over what this means for the future of policing in Racine in terms of recruiting new hires. Palmer says Racine PD is short 20 officers right now. Reporting for the I-Team, I'm Sean Gallagher.